Okay, today we're going to discuss sexual assault in how it's handled in San Antonio in the Baptist Health System. So here's a list of some of the nomenclature. We have law enforcement or LE, MSTH or Methodist Specialty and Transplant. These are where adult sexual assaults are taken care of. RAIN or the Rape Abuse Incest National Network. RCC or the Rape Crisis Center. Sexual Assault or SA. The SANE or SANE, Sexual Assault Nurse Examiner, and then some of the phone numbers for contact numbers. So here's the algorithm for those that are 18 years of age and older in a sexual assault. This algorithm can also be found on the STRAC, that's STRAC, the Southwest Texas Regional Advisory Council, online. So if the patient is under 96 hours since the event, they basically have three choices. They can have both the police notified, and a forensic sexual assault exam. They can opt to have a forensic exam for collection of evidence, but not notify the police, or they can decline both forensic exam and legal involvement. All of these require us to do a medical screening exam, offer pregnancy prophylaxis and STD prophylaxis. The patient, once they have had this medical screening and treatment for pregnancy and STDs, will then be transferred to a facility for a sexual assault exam by a SANE nurse. At the SANE facility, the patient will not see a physician, so it's important that we do all the prophylaxis prior to transfer. Once again, at the facility where the patient will receive the SANE exam, they will not see a physician. All of these patients should have a memorandum of transfer completed, and the accepting provider will be the SANE nurse at Methodist Specialty and Transplant. Now here are the nurses to contact the SANE nurse at Methodist Specialty and Transplant. This again is available on the STRAC website as well. Now if the patient wants a SANE exam as well as the legal exam but refuses transfer to Methodist Specialty and Transplant, state law requires that they be given that exam at the hospital. That is, they would have to receive it at our hospital at the Baptist Health System. Ideally, we should explain to the patient that it would be better for them to have it where they do these exams all the time in order to obtain the best results. Again, we do the STD and pregnancy prophylaxis prior to transfer, and I would recommend building these medications into your favorites folder. State Bill 1191, which was enacted in September of 2016, requires each emergency department in the state to be able to provide sexual assault exams and develop a plan to train personnel on sexual assault forensic evidence collection. Now, the Baptist Health System does have a SANE nurse on call, but they rarely do them because we have a regional center of excellence for this. So what do we do if the patient refuses to be transferred? Well, we call the house officer, who should come and speak with the patient and explain to them as well that it would be better for them to go to Methodist Specialty and Transplant for their exam. However, if they still refused, a sexual assault exam, forensic exam, will be offered to the patient. However, they'll be asked to sign a form releasing the hospital from responsibility. And here's that form. Again, this will be the responsibility of the house officer to come and speak with the patient about this. And here's the algorithm for sexual assault victims who are 17 years of age and less. This is broken down into less than 96 hours and greater than 96 hours, and then again whether the patient is safe at home or not. So if the event is less than 96 hours, CPS and law enforcement have to be contacted. And a key difference in sexual assault in those 17 and younger is that law enforcement will decide whether a SANE exam will be done or not. The family may want an exam, but if law enforcement says no, there will not be a forensic sexual assault exam. If the event is greater than 96 hours and it is felt that the patient is safe to go home, then the patient can be discharged with outpatient follow-up. The Children's Hospital of San Antonio is the center for sexual assault exams for those 17 years and younger. And here are the numbers for those. Those patients who are to be discharged home should have contact and a report made with CPS and law enforcement if there's suspected abuse or neglect. One last thing, I recommended that you create your own sexual assault drug medications folder. You can also use mine that I have created and shared under Freemire. And this completes our discussion of sexual assault. Again, if you have any questions, please let me or one of the ED directors know. Thank you.